Welcome, class. We are on Unit 8, which is Chapter 21 in your book, Musculoskeletal System. The functions of the musculoskeletal system are they give shape and form to the body, maintain posture, permits movement, protects internal organs, stores calcium and phosphorus, produces heat, and produces some blood cells. Normal changes of aging in the musculoskeletal system. The muscles weaken and lose tone. Bones lose calcium. Height is lost due to shrinkage in the space between the vertebrae and the spine. Loss of muscle mass causes weight loss. Joints are less flexible. Disorders associated with the musculoskeletal system. Osteoporosis is a big one. Bone loss, the bones become brittle and break easily. Arthritis, there is osteoarthritis and rheumatoid arthritis are the two main ones. Osteoarthritis is degenerative and it's a loss of cartilage. Rheumatoid arthritis affects the membranes that lines the joint capsules. And rheumatoid arthritis, it's not on here, but it is an autoimmune disorder as well. Amputations, surgical removal, or some or all of a body part. Sometimes they are necessary due to diseases such as diabetes that cause poor circulation, cancer or trauma, car accidents, things like that. A prosthesis is an artificial device that replaces a body part. There are prostheses for eyes, teeth, arms, legs, hips, and heart valves. A couple of abbreviations that go along that you'll see often for amputations: BKA, which means below the knee amputation, and AKA, above the knee amputation. Oops. Phantom pain is the feeling that a body part is still present after it has been surgically removed or amputated. You need to remember that that sensation is real. They may say my leg hurts, and you're looking and you see that the leg has been amputated. That's a real sensation that we actually treat and give medication for. Muscles are a group of tissues that help the body to move by contracting and relaxing. They support the body, protect organs, and create heat. There are three types of muscles. We have skeletal muscles. Those are voluntary muscles. We have control over those muscles. It controls movements and contracting and relaxing. So those are skeletal muscles, are the muscles that are stretched over the skeleton. Smooth muscles are involuntary muscles. They make up the walls of organs. So this is like the inside lining of your esophagus, the inside of your stomach, inside of your intestines. They still move things through the body through the wave-like motion, but they're not anything that we have conscious control over. Cardiac muscles are involuntary muscles. They're found only in the heart. Fractures, we're talking about bones. Fractures, a broken bone, usually from trauma or accident, but in the elderly can occur due to weak bones from osteoporosis. A fractured hip is a very serious injury that can occur from falls in the elderly. Types of fractures. You can have a closed or simple fracture, a hairline fracture, an open or compound fracture, which is where the bone has come through the skin. Green stick is where it's kind of splintered, but it's not all the way through. Comminuted means that there's little pieces. It's kind of crushed and there's little pieces. Often a comminuted fracture would be one that needs pins to get those pieces back together. And a compound fracture, they use pins too. Compression fracture occurs only in the spine and is when the vertebrae compress against each other. Joint replacement is common in the older population. A total hip replacement, or THR, is surgical replacement of the head of the femur and the socket that it goes into. If you're taking care of somebody who has had a total hip replacement, there will be orders regarding their weight bearing. Partial weight bearing, it means that they are able to support some body weight on one or both legs. non-weight bearing, unable to touch the floor or support any body weight or one of the more legs, and full weight bearing, where they can bear full weight. So you'll have to pay attention to your orders of getting people out of bed after a hip surgery, if they're allowed to bear weight or not. Bones are rigid connective tissues that make up the skeleton. Bones lend support to the body structures, allow for the body to move, and protect organs. Know the 4 types of bones. Long bones, humerus is the upper arm bone, and femur is the upper leg bone or thigh bone. The femur is the longest bone and the strongest bone. Strongest bone. Short bones are like the carpals in the wrist, you see a picture of there, and the tarsals in the ankles. Flat bones consist of the sternum or your breastbone and the scapula, which is your shoulder blade. Irregular bones, example is the spine. Joints. The joints are where 2 bones meet. They provide movement and flexibility. Types of joints are immovable. An example of an immovable joint is the skull. Slightly movable, example would be the pubis bone. Freely movable would be your hip and shoulder, which are ball and socket joints, and your elbow and knee, which are considered hinge joints. That's it.